Again, welcome to today's session of the Tennessee Harm Reduction Project ECHO. Today's topic is 2024 Drug Overdose Surveillance Program Data Updates and Trends in Route of Administration. Today we'll have our didactic presentation followed by a scenario presentation and Q&A. And per usual, we're using Menti, so that is a way to anonymously engage with the presentation and the scenario if you would like, but you can also engage through the chat box or you can raise your hand and unmute. Next slide. So our speaker today is Jessica Korona, who is an epidemiologist in the Advanced Analytics and Visualization Unit within the Office of Informatics and Analytics at the Tennessee Department of Health. Her work focuses on drug overdose surveillance and data linkage initiatives aimed at improving public health response and outcomes. Her research interests center on health services research, particularly how surveillance data and data integration can be leveraged to identify gaps in healthcare access and inform harm reduction strategies for substance use and misuse. So thank you so much, Jessica, for being our speaker today. We super appreciate the last minute request. Thank you, and please let us know when you want to advance the slide.
Yeah, perfect. No, excited to be here and talk about our drug overdose data. I know our federal partners are struggling, so excited to just give a chance to talk about our 2024 drug overdose surveillance program data, and then trends and routes of administration from a recent analysis that we did. Next slide, please. Okay, so we created a 2024 provisional drug overdose data brief. Stepping back before we get into the actual data, previous to this year, we were only allowed to share finalized drug overdose surveillance data, which means that our most finalized year right now is 2023, and it's almost 2026. So death data is very delayed. Finally, this year, we got permission to share 2024 provisional data and provisional data in general. So we're really excited to share this with you all and be able to dive into trends that we see for the whole year 2024 at a statewide level. Next slide, please. So a brief background about our office in case you haven't heard of us. So I work in the Office of Informatics and Analytics. This office was created in 2016 to be the trusted leader in providing data-driven solutions for public health in Tennessee. And our group consists of three core units: data governance, core informatics, and advanced analytics and visualization. And together we work together to conduct drug overdose surveillance, transmit, store, do data analyses, and disseminate data safely. Our office is also the trusted leader in providing data and analyses on drug overdose and the evolving epidemic. So over the years, we've built an overdose surveillance program, and we're always excited to share that data. Next slide, please. Okay, so a national context before getting into Tennessee's data. So these charts are from CDC's website. They update them monthly or bi-monthly, depending on how busy they are. But the first graph shows the national trend of drug overdose counts, including provisional data, and the second graph shows Tennessee data. So all this to show that the trend in Tennessee really mirrors that of the nation. We saw the drastic decrease in 2024, and then we're seeing a plateau in 2025. Next slide, please. So some notes on provisional data before we get into it. This is provisional, it's not finalized. We identify drug overdose deaths using death certificate data and the ICD-10 coding, where the drug overdose is the underlying cause of death. And we include all manners of death, so accidental overdoses, undetermined, intentional, and overdoses that were declared as a homicide, although those are very rare. But it does take some time for the death certificate data to make it to the state. The Office of Vital Records collects all of this data. Right now, at this point in the year, most of the data for Tennessee residents who died in Tennessee is complete, but we're still waiting on data from Tennessee residents who died out of state, and it takes longer for those people's information to reach our Vital Records office. The number of those people is small, usually about 60 people every year. So these trends will not change significantly, but when you see our finalized report, the final numbers will be slightly different. So next slide, please. Okay, so now getting into our provisional data. So this slide shows drug overdose deaths among Tennessee residents from 2019 through 2024. Our provisional data shows a 31.6% decrease from 2023 to 2024, really attributed to all the great work of people working in prevention and harm reduction throughout the state. So a lot of great work going on. There's still a lot of preventable drug overdose deaths that are occurring. So still a need to continue putting efforts towards harm reduction, prevention, and drug overdose surveillance. Next slide, please. Now I'll go into some different drug types over the next couple of slides. This slide shows drug overdose deaths among Tennessee residents by the all drug category, all opioid category, and all stimulant category. So between 2023 and 2024, drug overdose deaths decreased in all of these categories. However, you can see that any stimulant category did not have as drastic of a decrease as the opioid category. So something that we'll monitor over time. Next slide, please. This slide shows opioid overdose deaths among Tennessee residents from 2019 through 2024. Again, opioid overdoses decrease. The fentanyl line really mirrors that of the all opioid line. 90% of opioid overdose deaths include fentanyl. So a lot of illicit fentanyl drug use going on in Tennessee and causing drug overdose deaths. We also included pain relievers here. Pain relievers decreased from 2023 to 2024, and heroin remained pretty constant, but a very low number. We see almost no heroin in our data. Next slide, please. This slide shows stimulant overdose deaths among Tennessee residents for that same time period. Again, the stimulant category decreased, and then we have a category stimulants other than cocaine. This is predominantly psychostimulants or methamphetamine, and then the bottom line is cocaine. So from 2023 to 2024, all of these categories decreased, but the cocaine category did not decrease as drastically. So again, something that we'll monitor over time. Next slide, please. And we know that there's a lot of polydrug use in our data too, especially co-use of opioids and stimulants. So this slide shows the combination of opioids and stimulants being present on a death certificate. And this combination did decrease from 2023 to 2024. This looks very similar to the previous stimulant graph. So the opioids and cocaine opioids and stimulants other than cocaine category did see a decrease. But when we look at the opioids and cocaine category, we see that the decrease was not as drastic. So again, something that we'll look at going forward. There's been mention of increased cocaine use. So something that we're seeing in our data slightly, but we look to confirm as the finalized data comes in. Next slide, please. So now I'll transition to some demographic trends, but before I do that, I'll just say that we have not detected any medetomidine in our 2024 provisional data yet. I know that's been going around in the media a lot. We have not seen it on death certificates yet. We did see a slight increase in xylazine in 2024, but the numbers are still pretty low. So just something to keep in mind as the finalized data comes in. But next slide, please. So these slides show the changing count of fatal drug overdoses by age. And this is an arrow chart. So if you haven't seen one of these before, this slide shows the magnitude of change and also direction of change between 2 years. So the dot on the right is the 2023 count of fatal drug overdoses per age group, and the dot on the left is the 2024 count of fatal overdoses per age group. Now, all age groups experienced a decrease from 2024 to 2023, but it was not consistent between all age groups. So the 65 and older age group experienced the smallest percent decrease between these 2 years, but overall, the distribution of counts per age group remains consistent between 2023 and 2024. Next slide, please. This slide shows the changing counts of fatal drug overdoses by sex. So both males and females experienced a decrease between 2023 and 2024, but this decrease was not equal. So females experienced a smaller proportion decrease compared to males. Next slide, please. This graph shows the changing counts of fatal drug overdoses by race from 2023 to 2024. So all racial groups experienced a decrease, but it was not consistent for all groups. White Tennesseans experienced the largest decrease between 2023 and 2024, and Black Tennesseans and Tennesseans of another race experienced a smaller decrease. Next slide, please. So now looking at it geographically, so this slide shows age-adjusted rates of drug overdose deaths by region and year. So This is using the public health region breakdown, and we added 2022 data as another year of comparison. Between 2023 and 2024, all regions experienced a decrease in drug overdose deaths. The regions with the highest burden of drug overdoses were Knox Metro, Nashville-Davidson region, and East Tennessee. And I'll give you some time to look at what regions you might be interested in. Okay, next slide, please. This just shows a map of the age-adjusted rates for 2024. So again, the highest rates of drug overdose are in Davidson County, Knox County, and East Tennessee region. Next slide, please. Okay, so now I'll get into a spotlight presentation looking at the trends and routes of administration for drug use in Tennessee. So these slides are taken from a presentation that our office did in coordination with the Syndemic Coordination Program, and where we looked at trends and routes of administration and then associated harm reduction in Tennessee. So I'll focus on the route of administration data for this presentation. Next slide, please. So again, starting nationally, we know that there's changes in drug use behavior. So this graph is from the CDC, from the state unintentional drug overdose reporting system. And that data system found that there was a decrease in injection drug use and an increase in smoking over time. And this has implications for harm reduction. And it's challenging for harm reduction that we're legally able to provide in Tennessee. Next slide, please. So CDC found that data nationally through their SUITR system, and this is a map of all the jurisdictions participating in SUITRs, and Tennessee does participate in SUITRs. So we are funded to collect data and provide it to CDC so they can look at the data nationally, and then we look at the data internally to the state of Tennessee. So some more detail on SUITRs. SUITRs is a surveillance system that collects information on accidental and undetermined manner of death drug overdoses, so a subset of overdoses that I had just presented on. Next slide, please. Now, SUITRs is a little bit different than other surveillance systems. It's very robust. So we identify deaths using death certificate data. Then we collect other information from death scene investigations, autopsies, toxicology reports, and controlled substances monitoring program data to capture as many details about a person around their time of death that we can. Now, we collect as much information per person that we can. At the end of the year, we typically have all of this information for 75 to 90% of deaths. So not a fully complete system, but still very robust and a lot of great data that we can use for different analyses. Next slide, please. So I'll just go over some brief methods that we did to identify the patterns in our data. We used our SUITRs data from 2019 through 2023. Then we limited to deaths that had scene evidence available. So not every death will have scene evidence. So we limited just to make sure that the numbers were making sense with what we were sharing. Then we use scene evidence to identify routes of administration patterns. The most frequent patterns that we see are injection, smoking, ingestion, and snorting. And we identify these with scene evidence. So for injection, we'll look for evidence of needles and syringes, tourniquets, or cookers. Smoking, we'll look for vapes, blunts, really any evidence that someone was smoking anything. Ingestion, it's usually pills or empty containers for prescriptions. And then snorting, usually powder or straws on scene. A lot of other options can fit into these categories, but just some examples. And then we just descriptively compared across demographics and geography. Next slide, please. So this slide shows trends in routes of administration from 2019 through 2023. The first graph shows all of the routes overall from that 4-year period. So injection is the evidence that we most frequently see on the scene. However, that has changed over time. So the second graph shows the trend from 2019 through 2023, where we see a decrease in evidence of injection drug use at the scene and an increase in evidence of smoking and snorting. Next slide, please. Now we examined that demographically as well. So looking at age groups, injection was most frequent among the 25 to 54 age group. And then smoking, snorting were most frequent among snorting was most frequent among the less than 25 age group, and smoking and ingestion was most frequent among the 55 and older age group. Then when we look at sex, injection was more common among males, and smoking, snorting were also more common among males, and ingestion was more common among females. And then a note, so people can have multiple routes of administration. Sometimes there is a lot of drug paraphernalia at the scene. Sometimes there's not much there. So that's why these percentages don't necessarily add up. Next slide, please. Now, we also looked by grand division and race. So when we look by grand division, injection was most common in Middle Tennessee, and then smoking and snorting were most prevalent in East Tennessee, and ingestion was most common in West Tennessee. So again, this is limited to the data we're able to find at the scene, but this is what our data is telling us. Then when we look at race and ethnicity, we see that injection was more common among non-Hispanic white Tennesseans, while smoking, snorting, and ingestion were more common among Black non-Hispanic Tennesseans. Next slide, please. This map shows the percent of cases per county with injection evidence. So again, limited to the evidence that we found in our data, but still interesting to see where injection was more common. And then the stars show where there was at least one SSP in that county. Next slide, please. Similarly, this slide shows the percent of cases per county with smoking evidence. Next slide, please. The slide shows the percent of cases per county with snorting evidence. Next slide, please. And then this slide shows the percent of cases per county with ingestion evidence. Okay, next slide, please. Okay, so some key takeaways. We went through a lot of data, but drug overdose deaths decreased 31.6% from 2023 to 2024, but preventable deaths are still occurring. And then drug overdose deaths did not decrease as much for Black and other non-white Tennesseans compared to white Tennesseans. And then routes of drug administration are changing, which creates the need for different types of harm reduction to be provided. Next slide, please. Okay, so happy to answer any questions. And then also we have a number of publicly available data products that we provide. One is our public facing dashboard, and we're currently doing a survey to get feedback on that. We're also working on some interactive data story products. We're kind of like an interactive report with a dashboard where you could select what geographic region you're interested in looking at and what characteristics you want to look at. And we're looking to get user feedback on these to see if they're useful to people or how we could improve them. So I think there'll be a link in the chat. Feel free to message us if you're interested in providing feedback so that we can make useful data products for people. But thank you and happy to answer any questions.